I'm pleased to say that the AMA WA had a very productive meeting last evening with the Director General of Health, Dr Russell Weiss, with Dr Andy Robertson, the Chief Health Officer, with Dr Liz McLeod, and with Dr Chris Blythe from the Health Department, and that gave us a degree of reassurance and satisfaction around the way that that whole team working along with our profession to really deliver great results. At the start of this, back in January, February, the AMA expressed some frustration around the closure of the borders and all of those things that subsequently came about. And what we were hoping for at the time, what we were calling for when people were saying that we were perhaps being a bit alarmist, what we were hoping for was this week, where we had 7 days of no new cases in Western Australia, where Australia has become the envy of the world, and where Western Australia has in some ways become the envy of the other states within Australia. We're incredibly grateful for all of the sacrifices that the public have made. People have lost jobs. People are probably at the worst point in their life, and we know that the mental health challenges that people face, the economic and health challenges they face are terrible, but we also want to get out the message that you're not on your own, and that certainly our profession, and I'm sure the rest of the state and the country, will pay back the sacrifice that you've made as many times over as we can. There are problems going on in Tasmania, in Victoria, in New South Wales and in Queensland, and we would be foolish to assume that if we have disease still in Western Australia that it's not going to break out at some stage. That's the big question. Do we have asymptomatic spread? People passing on this disease without realising they have it through no fault of their own? And is it creeping around out there, and is it going to pop up again as it has in the abattoir in Victoria? So we're very pleased that the state is rolling out the DETECT trial to test asymptomatic people. We're very pleased that it's going to include people in schools and people who work on mines. And obviously from our perspective, we wanted to see it include a lot of healthcare workers and a lot of patients who are coming into hospital for other reasons, and we'll be working with the government to try and make sure that that's satisfied. We have been frustrated at some of the restrictions that are still around doctors on testing. We understand that there was a need for those. We don't agree that that needs to continue, and we want to see that improve. The tight borders, the testing and the regional plans all need to be held in place at the moment, and we certainly need a lot more time before we can see big deregulation of those things. In terms of easing the restrictions around gatherings and so on, and then watching the test numbers closely, that's a very reasonable thing to do as the test numbers get higher and higher. But the key is definitely to keep those tight borders and regional travel restrictions in place and study the people who fly in and fly out closely. And we should be getting on with working out how we can fix and tweak the economy in ways that it continue to thrive and survive in the face of what's going to be with us for a long time, which is constant surveillance testing, social distancing, hygiene, and much better cleaning. I don't think that we are yet getting across the idea of how long this thing can sit around on surfaces. We haven't ingrained that into our psyche yet, how carefully cleaned places where people gather have to be, and on such a frequent basis. So those images we see on the TV of high pressure steam cleaning going on, that's what needs to become commonplace in our society.